Dr. Mohammed Zubair Akram, MBBS, FCPS, Medical Education. Learn, explore, grow.
Hi everyone, my name is Dr. Zubair.
When we think about the progression of dementia, it is helpful to divide the disease into distinct stages. Understanding these stages allows patients, families, and caregivers to better prepare and plan for care. Alzheimer's disease is generally described in 5 stages: preclinical Alzheimer's disease, mild cognitive impairment, mild dementia, moderate dementia, and severe dementia. Alzheimer's disease begins many years before any visible symptoms appear. This earliest phase is known as preclinical Alzheimer's disease and is typically identified only in research settings. During this stage, neither the individual nor those around them notice any symptoms. This phase can last for many years and, in some cases, even decades. My name is Dr. Zubair, and my research focuses specifically on this early stage. The ultimate goal of my work is to identify who is likely to develop Alzheimer's disease before symptoms begin. By the time symptoms appear, a significant number of brain cells have already been lost. Once brain cells die, they cannot be repaired and lost functions cannot be restored. However, if we can identify the disease early enough, we may be able to prevent or slow brain cell loss before irreversible damage occurs. Mild cognitive impairment, or MCI, represents a transitional stage between normal age-related forgetfulness and the more serious memory problems associated with Alzheimer's disease. Individuals with MCI experience mild changes in thinking and memory that are noticeable to themselves and their families, but these changes do not significantly interfere with daily activities. Within 5 years, approximately half of individuals with MCI progress to dementia. About 25% regain normal cognitive function over time, while the remaining individuals remain stable. The next stage is mild dementia. At this stage, individuals are often still able to drive, work, and maintain social relationships. However, memory problems become more apparent. They may forget familiar words, misplace everyday objects, and become more easily confused. Mood changes and a loss of interest in previously enjoyed activities are also common. Alzheimer's disease is often diagnosed during this stage, as memory difficulties begin to clearly interfere with daily life. Despite these challenges, many individuals are still able to function independently and attempt to compensate for their memory decline. As the disease progresses to moderate dementia, confusion and memory loss worsen, and individuals begin to require assistance with daily activities and personal care. Wandering behavior may occur, often as individuals search for environments that feel familiar. For safety reasons, they can no longer be left alone. It is also common during this stage for individuals to develop unfounded suspicions, such as believing that family members or caregivers are stealing from them or that a spouse is being unfaithful. Restlessness, agitation, and, in some cases, aggressive behavior may emerge, particularly later in the day. In the final stage, known as severe dementia, physical decline parallels cognitive decline. Individuals typically lose the ability to communicate. Muscles become rigid and reflexes become abnormal. Eventually, the ability to swallow and control bladder and bowel functions is lost. At this point, the individual requires complete assistance with eating, dressing, using the bathroom, and all aspects of daily self-care. Due to a weakened immune system, individuals in this stage are at a high risk of developing infections such as pneumonia, which is a common cause of death among people with dementia. The rate at which Alzheimer's disease progresses varies widely from person to person. On average, individuals live between 8 and 12 years after diagnosis, though some may live for 20 years or longer. Life expectancy is generally shorter when the disease is diagnosed in a person's 80s or 90s.